the inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Senate Republicans, led by Kentucky Senator Mitch McConnell, have been meeting behind closed doors to formulate their version of the American health care bill to fulfill their promise to repeal and replace the 2009 Affordable Care Act, Obamacare. Tactically, McConnell wanted a snap vote before July 4th holiday, but that failed and the bill had to be pulled and back for negotiations and to find a way to hold together both a Republican right wing led by Kentucky Senator Rand Paul and moderates who have disagreed with this bill. Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. As everyone, including President Trump, understands by now, health policy is complicated. The formal drive to extend the availability of health care coverage to Americans dates to the 1930s. President Roosevelt wanted to companion proposal to the Social Security Act for health care, but withdrew it in the face of Republican opposition. It was another 30 years before Medicare and Medicaid were established in 1965. When the Democrats won the White House and the majorities in both houses of Congress in 2008, they decided for a renewed push for expanded health coverage. For more than a year, arguments raged over the proposed Affordable Care Act, and just before a decisive vote, then Cincinnati Congressman Steve Driehaus got assurances that convinced him on the question of abortion to support the Affordable Care Act. To talk about where we stand at this moment, I am joined this morning by Steve Driehaus, who has just returned after serving for 6 years as director of the Peace Corps in Swaziland in southern Africa and Morocco in northern Africa, and Dr. Odell Owens, who is now the president and CEO of Interact for Health, a 20-year-old foundation that works to improve health of people living here in greater Cincinnati. Dr. Owens has served as a leading obstetrician and the Hamilton County coroner and the president of Cincinnati State before assuming the reins of Interact for Health last October. Both of you, welcome back. Steve, welcome back to the United States.
Thanks, appreciate it. Thank you.
What do you, when you see what's happening right now with the Health Care Act, that you put so much into and risk your political career on, and in many ways may have cost you your seat in Congress.
Which was a blessing in disguise, by the way.
Well, we can talk about that, but what do you see right now? What are your thoughts when you see what's going on?
Oh, I think it's terribly unfortunate. You know, you mentioned that, we spent a year talking to people. I had hundreds of meetings, with healthcare professionals, with insurers, with, people with disabilities, with parents that had kids with pre-existing conditions. And our intent at the time of the passage of the Affordable Care Act was to improve our healthcare system for so many Americans, by taking away those restrictions for pre-existing conditions, by extending the limits and not allowing insurance companies to cut people off if you were actually taking advantage of insurance when you got sick, to keep those kids on their parents' policies up to the age of 25. These were all very important to the American people. What you see today is you don't see that discussion at all. Those conversations are not taking place. This isn't about improving our healthcare system. This is about, a political vendetta against President Obama, who's left office. The American people don't want this. The American people have not asked for this. But because the Republicans have been promising it for 8 years or whatever it is, they feel that they need to deliver this, and Trump feels that he needs to deliver this. And I think it's really unfortunate because it's not about improving health care, which is really what we should be focusing on. Yeah, there were problems with the Affordable Care Act. We should be fixing those problems.
We can come back to that. Odell, you see this from your responsibility at the local level. Okay, if the discussion in Congress isn't about the sort of health care reforms, and there were a lot of others that were built in to the 2009 Act. I mean, all kinds about record keeping and ways of changing, trying to make sure people didn't come back to the hospital after they had been treated. There are all kinds of things built into that. From your perspective on the local level, how do you see what's going on in Washington?
Well, you know, Interact for Health has a 20-year history of actually working to help people get access and pushing for the expanded Medicaid. Now, when the expanded Medicaid for Ohio was enacted, 750,000 people got health care who didn't have health care. With this proposed change in the bill, you will lose that. But more importantly, part of that group are the people who are trying to kick their heroin addiction. Mm-hmm. And if you take away their ability to get that medical treatment, then we get real problems. Interact for Health, just in the last few years, has spent just on Narcan $500,000 put into the community to help save lives. So this is a big, huge issue.
Interact for Health is a private foundation. I just want to make clear, if these sorts of pullbacks occur, financial pullbacks, can private organizations step forward and fill the hole?
No, we don't have that kind of money. Interact for Health, our budget a year is like $10 million. So we actually put into the community probably $8 million in grants. So our role is to, one, enact policy. We're strong in putting money into policy to affect change, but we couldn't cover that gap. Now, I say that, but on the other hand, we have 35 school-based health centers that we will protect. So if there's a cut, then we will relook at our budget, refocus, and ensure that those school-based health centers stay afloat.
Okay. Steve, you were saying that the approach could be to find ways to fix problems with the Affordable Care Act or improve it. Are there things that you really think, you know, would be high priorities for you if you wanted to make some improvements, some changes?
I think allowing the exchanges to work would make a lot of sense, as they were intended to work, because, you know, it was sabotaged from the get-go in many states. You know, the idea was to compromise between Republicans and Democrats, create a free market system, but a regulated free market system, where you would have the ability to purchase health care and take it regardless of your job and receive subsidies depending upon your income level. And also bring people into the system that weren't currently in the system. I mean, the bills that you're talking about now, both the House and the Senate bill, would exclude tens of millions of people. Tens of millions of people would lose their health insurance. How an elected official, acting in the best interest of his or her constituents, can sit there and think that that is okay, that it's okay for me to put millions of people out on the streets and not have health insurance, and now their primary care is going to again be in the emergency room, driving up the cost for all of us. I think that's obscene.
Odell, you are a doctor yourself, even though you're doing lots of other things. I'm sure you're in touch with the professionals in the medical field. Do you think that Obamacare changed the way people accessed health care? Did we get fewer people coming to emergency rooms, which we all know is very expensive? Did that actually change that? Did it deliver on the promises that it made?
I think in many areas and many situations it did decrease. I look at the years at the Cincinnati Health Department, and I can tell you that the uninsured went from about 60% down to about 10%. And they start really being able to access the health department.
You mean the uninsured people seeking help from
they were
the
60%, they were uninsured. When Obamacare came in, that number dropped down to about 10 to 15%.
And what did that mean?
And a good deal of that was undocumented who couldn't get insurance.
Okay, but what did that mean for the health department, that they were no longer?
There were less people going to the emergency rooms.
Okay,
I can tell you that now. The health department took that burden on, especially in dental.
Okay,
especially in dental with our dental centers.
And then did you get reimbursed?
No. Well, we got reimbursed through Medicaid. We were able then to offer Medicaid. That's how we got it down. That's the policy. If you didn't have that, these people would not show.
Okay.
But the growth in overall healthcare costs has actually declined. So it has grown, but the rate of growth has been slower under the Affordable Care Act than it otherwise would have been. And that is due to the fact that we got people insured. So these false promises that are being made now by the president and others about reducing costs, I think they're living in a fantasy land. Costs are going up because of the health insurers. The more power you give to the health insurers, the greater tax breaks you give to them, they're going to turn around and they're going to charge the customers. this is a very, very difficult place for us to be as a country, and I think it's a bad policy.
Dan, the New England Journal of Medicine came out and said, I think last week, that for every 750,000, and that's the number of people that got the expended here in Ohio, if you change this bill and they lose their insurance, for every 750,000 people who lose their insurance, 1,000 people will die prematurely. 1,000 of our neighbors, our friends, our relatives.
It also changes, on a very simple, we sometimes forget that in Cincinnati, in Hamilton County, we've had the indigent care levy. We try to address some of this, and with Obamacare, that the demand for that has gone down, and for Tax Levy Review Commission, that means they were hoping that that money could then be shifted over to other needs, and that'll all come back again.
Absolutely.
We're going to have to look at local taxes in order to fill some of the holes, but we're never going to fill the sort of holes that are going to be there. Steve, you were there. I mean, it was hard negotiating, and I tried to pull up a sound bite with you, but it's so old. It's in the computer, but it doesn't want to render anymore. Where you, just before you voted, got an agreement that you felt made it possible for you to vote for. It was about abortion and not spending federal funds. And so you've been in this crunch. I mean, taking away the substance of what we're talking about here and only talking about the process. I mean, the Republicans are trying to get this through. What do you observe about the political process that's going on at the moment? I mean,
I am not at all optimistic. I'm very, very, and by not being optimistic, I'm afraid they're going to pass a bill. I think they will get the votes they need. I think McConnell will work very hard on the various senators that are out there, because they have said they're going to deliver on this promise, and I believe this is their number one priority, to deliver on this promise, regardless of the impacts, the human impact it has on people back home. And that to me is a tragedy, that they're so hell-bent on delivering on this promise that they're not looking at the ramifications that it's going to have on their constituents. And their constituents are going to feel it, and they're going to feel it in a big way.
Odell, being part of the community the way you are average people out there talking about this? Are average, the people who maybe got insurance when they hadn't been able to, and some of that's not just, these people could be working multiple jobs and they hadn't been able to, are people, ordinary people, do you think, focused on this, or is this happening with people who pay attention to politics type of thing?
I think people are listening to this and are talking about this, because there are a couple of, Steve we were talking before the air, there are other things they can do. Under the Obamacare, the cap in terms of the amount of money that could be spent on you as an individual is removed.
Right.
But they're talking now bringing that back. That means if you have a catastrophic effect, you have a premature baby that's real premature, liver transplant, a kidney transplant that goes bad, or your child has a horrible childhood disease, you hit $1 million, you're done. No more health care for you. People are talking about that. People realize the advantage of having to be able to keep their children, as Steve said earlier, on their insurance until they're 25. So these are some personal issues, or the ability for a state to say, okay, we'll allow insurance companies to decide what they want to offer. They don't want to offer prenatal care. They want to cover pregnant women. They don't have to cover it. That's wrong. So I think they have hit a nerve. And I think a lot of people who may vote for this won't be coming back. I think this will be the issue this time, that people, both Democrats and Republican constituents, are going to stand up and say, this is wrong. They don't support it now. 12% support this right now.
You're going to take us back to the time where people went into bankruptcy to pay for their health care bills. And do you remember that? I remember going to fundraisers for my constituents who couldn't afford their health care, because they were getting treatment and insurance companies cut them off. We're going back to that. And, if you're between 50 and 65, that's where the projected costs are really going to increase fourfold. It's expected. And that's because, many of us have pre-existing conditions. Who do you know in your age group? Who do I know in my age group that doesn't have some type of pre-existing condition, who will be denied health care or who will pay exorbitant fees for their insurance? That's what we're going back to. And I think the average American is very concerned about that. Certainly if you're between 50 and 65, you should be very, very concerned, because Medicare is not going to pick you up until you're 65.
I just got about a minute left. Odell, given your position at Interact, but also your history in this community as a doctor, have you had a chance to talk with Senator Portman, with Brad Wenstrup, who's also a physician, with Steve Shabbat? Do they come to you and say, Odell, let's talk about this?
Well, we are a conversion foundation, and the rules of a conversion foundation, I'm not allowed to lobby. So I have to be very careful how I approach any public official or any issue. And we provide funds. We can fund organizations who are currently having that conversation.
But if I'm
with
a congressman, could I come and ask you?
You can come
I'm
ask
not
for
a
information.
healthcare person.
You can ask me for information and an opinion.
For information.
Right. And I haven't had that.
It hasn't happened then?
That conversation. A little bit of conversation with Portman last summer when he was running. But not Wenstrom. In fact, I did talk to Wenstrom, but I just called him to thank him for being a hero at that baseball game.
Oh, the baseball game, that's a whole
was a hero.
thing. I know, terrible. Okay, first off, thank you, both of you, for being here this morning. Steve, welcome back, and we're going to have you back, and I want to hear more about your experience in Africa and what the dynamics are there and what your observations were.
Sure,
so,
thank you.
Very good. Stay tuned. After the break, Nancy Grayson, the leader of the new Horizon Community Funds of Northern Kentucky. Welcome back. For the last 35 years, Northern Kentucky, driven by the success of the International Airport as a hub, has become the most vibrant economic region of Kentucky and one of the growth centers of Greater Cincinnati. Over that period of time, Northern Kentuckians have worked together on a series of community visioning efforts, Forward Quest, Vision 2015, now Skyward, that have driven development and collaboration across 9-county region. Today, over 400,000 people live in Northern Kentucky, accounting for 22% of the metropolitan population. But only 2% of the aggregate funds invested in local community foundations come from Northern Kentuckians. To change that narrative, leading Northern Kentuckians have announced this week the formation of the Horizon Community Funds of Northern Kentucky. That leadership list, which you see up right now, is a who's who of Northern Kentuckians, many with experience in business and public service. That group of leaders named Nancy Grayson the president of the new Horizon Community Funds. Mrs. Grayson is an attorney by background and was the director of strategic initiatives of the Northern Kentucky Education Council. Nancy, welcome to Newsmakers.
Thank you for
and
having me.
Congratulations on your new position.
Thank you. Day 5.
Day 5, yes. We'll get you early.
Yes.
The very first show I did, very first local Newsmakers I did was on the creation of what I guess it was Forward Quest. It was 22 years ago. So anyway, what is it that drove this effort to create this new community foundation?
About 1.5 years ago, Bill Butler with Corporex came together with a group of friends and colleagues and other community leaders, Chuck Shepard and Bob Zapp, and also Will Ziegler. And they had a long conversation, and it happened over a period of time where they said, you know, it's been several decades in the making, really. We need something, a public vehicle, a charity vehicle that allows people to come together and really impact what's happening in Northern Kentucky. So after a lot of further conversations and really engaging with some other leaders in the community, they decided now was the time to do that.
Well, that data that I pulled right off of your website of 400,000 people, 22% of the region, but only 2% of the giving for community foundations.
Yes.
So is this about the philanthropy giving side as much as it is about what you're going to do with the funding?
Absolutely, and really in my mind, the philanthropy aspect and creating that culture of philanthropy. We're really trying to elevate that in our region. So what can we do as Northern Kentuckians, as neighbors and community members, to really elevate what our needs are and try to provide resources for those needs? But also, how do we come together? We have that ability and a history truly of coming together, as you mentioned, for visioning over different initiatives and trying to face the heroin crisis and trying to address advanced manufacturing needs. So really relying on that history of coming together, but doing it for a philanthropic cause now.
How does this fit in to the Northern Kentucky Fund of the Greater Cincinnati Foundation?
So we really see our work aligning well with all the other community and private foundations in the community. It takes a rising tide for us to really be able to address the needs of the community. So for us, this is an effort really driven by Northern Kentuckians, so that it is by, of, and for Northern Kentuckians, which truly is the first of its kind that's happened in our region.
So that sense of ownership,
yes,
will change the curve in terms of the amount of philanthropy that is encouraged.
That is our hope. And we really truly hope that this isn't just for people who have large sums of wealth. You know, Northern Kentucky, it's broad, it's 400,000 people, but how can people who maybe haven't given on a regular basis become engaged in this effort? How do we engage young professionals and millennials? How do we engage young family members and really encourage future giving for generations so that we're changing the conversation?
Given that, though, I have to say, when I look at that board, that is a very established board. There's not a lot of that youth there.
Yes.
There's not much diversity, to be perfectly honest. So how do you cope with that desire to encourage new people into the process, given the board that's created this?
So as we're rolling this out, we're still building our Council of Trustees. We actually were just able to get Kit Andrews to join our board, and we have several others.
We've heard of her here.
Yes, you might know her name. So she, and we're actually reaching out to other women and other people who reflect the diversity of our community. So that's something that's important to us. But we really felt that it was time to let the word be known that we're forming this organization and that this is something that we want people to become involved with. So part of my job in the next several weeks and upcoming months is to have that conversation with different circles. I really think that this is going to take a time to set up and make sure that we're hitting the ground running.
Do you start with a certain corpus, so with a certain endowment, or are you starting from just operating funds? And if you're, what are your goals? Do you have in 5 years we want to be at? What's sort of either where are you now or what are your goals?
Well, we're just starting fundraising now, and so we really are relying on the leadership of that Council of Trustees, as well as my being in position to go out into the community and have a conversation about what individuals' goals are, but also organizational goals, so that we can start gathering those funds and really making sure that we have that corpus, that core set of assets that we can use to invest. In addition to that, I think it's important that there are different ways that people are allowed to invest. We're really focusing on the unrestricted funds, our community impact funds, so that we can have broad discretion in terms of investing, whether it's in community development, health, education, different issues that might be relevant, or if it's an emergency need, there might be some issue there.
Well, in any of these situations, unrestricted funds are the key to be able to be responsive. On the other side of this, are there certain challenges in the community that this group of people who have come together want to be better at addressing? Is a certain priority? Is it in education? Is it in economic development? Is it, you know, is there any sort of here's what we want to do with whatever money we raise?
We're having that conversation right now. I think it's important to us. We have a huge poverty issue. We have a lot of issues with health, and we want to make sure that education is successful. But at the same time, we want to be broader than that. So there could be community projects or initiatives with development or urban vibrancy that we want to focus on, or community vibrancy. So I think right now it's really having that conversation. So there could be collective conversations with leaders in the community about particular projects that maybe we don't even know about yet.
I've got about 40 seconds left. is there something that already exists, like the catalytic fund, for example? Will those things go on?
Yes.
Will they still, you're not replacing those things, or will they be absorbed?
They will not be absorbed. This is something that really complements, in my mind. There's a synergy around having different groups of people coming together, and so we tend to work hand in hand, and we expect to see great results.
Okay. I want to make sure that people know how to find you, because
Yes.
you're brand new. And if you go to their website, which is, there we go, Horizon Funds with a plural, with an S,
Yes.
.org. So, Nancy, congratulations.
Thank
you for being here. And there's just so much good stuff and new people in Northern Kentucky. As a place I grew up, I think it's a lot of good things going to happen.
Thank you.
Thank you for making Newsmakers a part of your Sunday morning. Have a great July 4th holiday, and join us again next Sunday morning to meet the women and the men working to make this a better region in the future. Have a good week.